Hi everybody, Jody Topitz, we2me, Divorce, Decor, and more. I am your host, and today I have a very exciting show. But first, as you already know, we2me is about creating a space that makes you feel comforted and nourished, especially after going through a transition. And all this is done through the uplifting psychological impact of color and design. And I will be sure to give you a design tip in the middle of the show. But what's really, really exciting this time is I have a very special guest, Dr. Song, who is from Omni Aesthetics, and we talk about making a nice space. He's going to about making a nice face. Up in your space and into your face. That's what we're going to name this episode. It's going to be great. So without further ado, I'm going to introduce Dr. Song, and we're going to talk a little bit further about our theme, which is about vampires. Isn't that intriguing? So tell me all about this transition. You transitioned. Why did you go from internal medicine to this?
Okay, so here's the thing. When I was a kid, my dream was to be an artist. So that's what I wanted to be. My parents wanted me to be a doctor.
Of course, why not?
And so I kind of, hedged, in college, I majored in studio art as well as biology.
Okay.
And I did like biology, and science really intrigued me. But my passion was really for art. And so I got into med school. That was really neat. And I wouldn't trade that for the world. I ran into one of my colleagues who was doing laser treatments for beauty. And, I saw what he was doing. I was really intrigued. I'm like, I could do this.
Yeah.
This is what, I could be a doctor
and an artist. Right, that's perfect.
Yes. I started really getting into rejuvenating the skin using your own body.
That's what's so cool. It's really interesting, and that's what brings us back, I guess, to the vampire facial, the vampire facelift.
Yeah.
We're going to talk about it in a minute, but I just want to ask you one more question because I think it's such a touching story, and it really paints a picture of what it's like to maybe make a small change and get so much out of it and so much self-esteem. When you and I had talked earlier, you told me a really cool story about a widow that you worked on, and tell us that story. That's a really neat thing. It wasn't just about beauty. It almost was, it's life-altering.
This is one of the surprising things. When I made the switch from internal medicine to cosmetic medicine, I thought that, I would be missing, the impact I would have on people's lives that I did when I was doing regular medicine.
Right.
This really cute patient that I have, and at the time, she was about 58 years old. She was a widow. Her husband had died a few years earlier.
Oh.
And she had kind of, in her mind, resigned herself to being an old lady.
Yeah.
So she dressed like an old lady, and her demeanor was like an old lady. And she came in with her sister. She said, "Jane, why don't you get a treatment?" And Jane said, "Me? No, it's not for me." And her sister insisted, and we started with a little Botox. And she came back a week later when it kicked in, and she was a different person. She had a little skip to her. She said,
"Yeah, a little skip to her walk, right?"
Yeah, and she said, "What else can I do?" And she realized that she didn't have to, do anything really major. Just a little injection could make a difference. We did a few other things.
All non-surgical.
All non-surgical.
All with your body helping heal.
Yeah, so what I did with her, actually, she went straight from Botox to, I suggested doing some fillers, and she didn't really like the idea of having foreign substances injected into her face, even though they're very safe. I mentioned to her that we also do a fat transfer. We can take the fat from
her own body,
somewhere where she doesn't want it, and put it into her face where she could use it.
That's ideal.
And she loved that idea.
Yeah.
So we used her own fat like a filler, and we gave her a little bit of a lift with her own fat, and that really changed her life.
That must have been fascinating to see her whole demeanor change and her whole personality.
Yeah, because then when I saw her a couple months later for a follow-up, she had found a new boyfriend.
Oh.
She completely changed her wardrobe, and even the way she walked was different.
It is kind of
Yeah.
amazing, isn't it?
Yeah.
Just such a small little change, something non-invasive, non-surgical, can give someone such, I like to do space lifts, and you do, in a way, you do a facelift. And that brings me to, this is kind of exciting, the vampire facial.
Yes.
Okay, this is coming out. Our show, by the way, is going to be airing the day before Thanksgiving, the day before Halloween, which is kind of so appropriate for this. But the vampire facial and the vampire faceless, all of that stuff, I decided that I was going to give everybody the very technical medical definition of a vampire facial. And then I
Okay.
thought perhaps you would take over and give a layman's
Well,
version.
let's hear your version.
You want to hear my version?
Yeah.
This, you'll be really impressed. Okay, so what happens is there's thousands of little microneedles that make holes in your face. It damages your skin just a little bit, and then blood is drawn, much like a vampire. It's spun out, and then somehow the plasma is placed all over your face, and it sinks in, and then your body is forced to heal, producing collagen, and then your skin gets tighter.
Well, that's...
How about that?
Yeah.
And
that's
how off
actually-
am I?
That's actually a pretty good description of it. I'd like to put it a little gentler.
Do the layman's version now. Right, go ahead.
Yeah, so the vampire brand is... the vampire is actually a trademark that Dr. Charles Runnels trademarked, and he was a genius for doing that because we've been doing this treatment. It's called platelet-rich plasma, where we take your blood and we extract the platelets out of your blood.
Right.
And the platelets are the secret because that's where the growth factors are.
Okay.
So when you get a cut or injure yourself, the platelets that aggregate to the area to stop the bleeding will release growth factors that attract stem cells. Now, stem cells can turn into anything. They can turn into skin cells, collagen, bone. So whenever there's any kind of damage to your body, or in just the process of, repairing, regenerating, it's your stem cells that are doing the work, and the platelets are the signal. They are the ones that send the signal for your body to do that.
To start healing.
So if we take some extra platelets out of your blood,
Right.
and
I'm following you, by the way. Look at me. Go ahead. You take it out.
Yeah, and then we place it, we can inject it right into the area that we want to rejuvenate.
Okay.
So we're tricking your body. So those platelets, in response to either the microneedling or lasers or fillers, will release that signal and recruit those stem cells to make new skin, new collagen, and just rejuvenate your skin using your own body's healing power.
All of this is very impressive. But what's going to be even cooler right now is that we're going to go and actually watch or see, I guess, a vampire facial partially in progress.
Okay.
Do we want to do that?
Before we do that, I'm actually training for Dr. Runnels for the vampire procedures, that brand. And as part of that brand, one of the treatments we do is the O-shot.
Yes, I've heard of the O-shot.
O-shot.
O-shot, and that
So-
has to do with the vagina.
Yes.
The vagina. I don't know how Donald Trump would say that, but I'm saying vagina. I don't know if he'd say gina, but okay, sorry about that. Anyway, not making fun of politics, just the way he speaks. It's okay.
Okay.
But yes, so that
uh,
tightens things up.
So what this does is, remember how we said that the platelets will rejuvenate,
Yes.
cause healing, increase the blood supply, sensation.
Right.
So if we put the platelets in very strategic areas.
In the vagina.
In the vagina.
Let's call it vagina. Vagina.
Okay.
Yeah, we do that.
Actually, it was first developed for treating incontinence, dryness, painful intercourse.
Right.
And issues like that people had.
So it addresses all of those things.
Yes, so it's great for that because it's rejuvenating that tissue. It's increasing the circulation, but it has this really neat side effect, which
Would you, I think
Well,
we
that's
have
why-
time. Do we have
that's
time
why
to
they
say
call
what
it
that
the-
is?
Well, that's why they call
yes.
it the O
I
shot.
get it. I understand now what the O
Yes,
stands for.
So, yeah, so that's
Okay.
a nice side benefit.
Well, having said that, I think it might be a good time
And
now.
there's a male version of it
Oh,
too,
good
called
Lord.
the
That might be a
P-shot.
second show. All right, we got an O, and we got a P, and I know what they both stand for.
Yes.
I have been around the block a couple times, I'm just saying.
Okay.
I think it's time now for us to stop and go perhaps see
Let's
the
go
vampire
see a
facial.
vampire facial.
Let's do it.
Yeah.
Okay, we'll be back. All right, everybody, follow me down the hall and let's go witness part of a vampire facial. Make sure you're okay with blood. Hello, Dr. Song. How are you? Fancy
Hey,
meeting
Jody.
you here again. Okay, so we're here. Hello.
Hi,
how are you?
I'm good.
Mwah. And you got your red lipstick
numb,
on.
so-
You're numb, so you can barely talk. Is that what it is?
It's a little numb.
Okay, but you look beautiful.
Thank you.
You're welcome.
Thank you.
So we are going to witness a little bit of plasma mushed on your
Microneedling.
face. Yeah, microneedling, all that stuff.
Yes.
And I'll let Dr. Song comment.
Yeah, so right now she's got some numbing ointment on her face because we wanted her to be comfortable.
Yes.
We put little needles in her face. But it's really not painful.
No.
We don't need to go deep. We're just making tiny little needle punctures.
Okay.
With our
So exciting.
Little pinpoint bleeding.
Pinpoint bleeding, a little bit of that, and then the blood's already been drawn,
Yes,
much
the
like a
blood's already been
vampire. Oh,
drawn.
look, everybody, bandage. Okay, all right,
So our nurse Beth is going to come and do some microneedling.
okay. Wherever Beth is, there she is. Let me get out of your way. Should I get out of your way?
Sure.
I'll be right here. Is this okay?
Yeah.
I just want to
You're
be in
not
the way.
squeamish with blood, are
No,
you? Okay, then it's fine.
it's fine. So everybody that's watching, if they're squeamish with blood, just, close your eyes for now.
It's not that bad. Are we actually filming?
Yes, we are.
Yes.
No, it's cameras are rolling.
So we're going to clean off Terry's face using alcohol so everything is nice and ready to microneedle.
Okay.
And we're not going near her eyes where she has makeup, so she can still look beautiful as I'm doing this. Also around her beautiful lips. So she's been numbed for at least 40 minutes.
Okay.
And she will be not really feeling the microneedling, which I can show you the pen that we use in a
Okay.
moment. We have some little
I'm
hair
excited to
here from her
see.
beautiful long hair.
Isn't it nice everybody staring at you?
Oh, that's beautiful.
Okay, I guess we are getting started. Here we go.
Are you comfortable, Terry? I'm very comfortable. Okay.
You don't even see anything.
We're seeing tiny pinpoint bleeding.
It's so small, though.
Yeah, so the needles are going about less than a millimeter deep,
Yep.
and it is making very tiny little punctures on the surface of the skin. So when it's numb like this, you really shouldn't feel any discomfort.
Yeah.
And this is how we're tricking the body into thinking that it's been injured so that we can get that healing cascade going.
Oh, wow. That's really, you know what I love about this is that it's really very organic. It's
organic.
It's your body doing
Absolutely.
its work, doing its job, what it's meant to do with a little trick or treat. The trick is this, and the treat is looking smoother and better, right? Is perfect
So
for
this by itself is a great treatment. This
Yep.
is a microneedling treatment. And if we put the platelets on top,
Then that's a vampire facial.
That's the vampire
Ah,
facial.
okay.
So that's the traditional vampire facial is
Cool.
doing the microneedling and just putting the platelets on the surface because those little channels that she's creating with the needle
Right.
are going to let the platelets get into her skin.
It's making almost like the skin porous, so it absorbs
Yes.
the platelets.
So, but what I like to do is I like to inject a little bit of the platelets because then it'll really make it pop.
It's extra
Yep.
bang for your buck, right?
So, yeah, when we do that, we can get some really instant results.
Wow,
And we'll show you that in a little bit.
that's really cool. And again, you're good with us staring at you, huh?
That's fine. And you're okay, Terry?
I feel absolutely nothing.
Great.
Awesome.
I want you to be comfortable.
Okay, everybody, we're going to return momentarily to see further the results. We're really looking forward to seeing that plasma spread all over the face and all the good things that it's going to do. See you in a bit. Okay, everybody, we're back and we're going to witness the end part of the vampire facial.
This is some of Terry's plasma mixed with obviously the platelets that were drawn from her blood, centrifuged and concentrated in this syringe. So basically what we do here is we just massage it in so it can seep into the tiny channels that were made by the microneedling. And that way we help the process along by really enhancing the amount of platelets that are in the area, and they of course send those signals Dr. Song was talking about earlier in terms of being able to draw signal stem cells to come, release growth factors, and create all of the collagen and elastin that we look for to be built in the skin.
So that redness she has is from the microneedling. That's going to be gone tomorrow. And although it looks a little red, it's pretty clear, the plasma. So if you remember the picture of Kim Kardashian with her vampire facial, it looked very bloody. It doesn't have
Did they
to be,
do that on purpose, as
probably,
like for effect?
for
just
effect,
to, yeah,
probably.
yeah.
You
It's
don't
not
have-
wasn't
it
realistic.
doesn't have to look that bloody.
Yeah. Anything for attention
Because
for her.
we're
Yes.
interested in the plasma.
Yeah.
We don't need all that blood.
Yeah.
And she can just wash this off in a cup in about. We like to keep it on about 4 hours.
Okay. I mean, you don't even see it actually. It's very transparent.
Mm-hmm.
The plasma itself is really just a vehicle for the platelets to get them to be able to float in the plasma and then be applied.
And by tomorrow she'll look fine.
Wow, that's pretty cool.
And we saved some for Dr. Song to inject. Here, there are times when he injects the platelets, the PRP, and sometimes I do, depending on what the client's looking for. So often around the eyes, around the crow's feet area, sometimes around the mouth, where people tend to get those smoker's lines and you know, from smiling and laughing.
Right.
Have those,
Having a
areas.
life.
Yeah,
As
be
you
happy.
should. As you should.
Minor laugh lines.
Minor laugh lines.
Okay, so let's.
I'll step back and let Dr. Song do his magic.
Okay.
Okay, so this is my little addition to the vampire facial, and this is actually what I teach when I teach the vampire procedures. We can actually give her a little pop by putting the platelets right in the cheeks. We can give a little volume. Although this is not a filler, it does give volume. So we can put it in a lot of the same areas that we inject fillers. So we can also inject it in combination with the filler, like a Juvederm. And when we do that,
Oh, I'm getting out of it. Am I in the way?
No,
Okay.
fine.
I'm hanging out with Terry.
You can hang with me.
Hanging with you.
We'll get beautiful together.
Yeah.
so if we do this in combination with a filler, that's what we call the vampire face lift.
Oh, so that's the difference. The filler mixed in with the
Yeah.
plasma is
So
the
right-
facelift, and this is the, well, that's what,
Yeah.
this is just the facial.
This is the facial,
Vampire
but what
facial.
I'm doing right now is kind of a in between.
In between.
Because
All right.
we're using the plasma without the fillers.
Got it.
And we can inject it in a lot of different areas. It's great for under the eyes.
Wow.
And
How are you holding out, camera woman?
fine.
No, I'm asking the camera woman. Looks like she's gonna. You okay there?
Terry's doing great.
Yes.
Okay, just a couple more shots here. And we're not going to do it today, but you can also do, you know, your O shot and
Oh.
yeah, at the
Oh,
same
the
time while
O
you have
shot.
it.
Right.
So-
Okay. Okay.
Yeah.
The
I'm not going
O.
to film that one.
No, we
That's-
won't do that one.
That'll be another show.
That's
maybe.
another show. We could do a second show on vagina.
Part
Okay, it's time for us to, is it time for us to say goodbye? Is it time for me to give my design tip? So Dr. Song, in honor of your vampire facial and you, I'm going to give a design tip that has to do with the color red. And the color red is very interesting because red is a stimulant. It increases your blood pressure and it excites you. If you often notice in restaurants, they're painted red because it'll stimulate your appetite. It's also gets you going in terms of exercise. Sometimes gyms are red. And of course, in the bedroom, it's a stimulant. You might want to paint your walls red right after the O thing. I'm just saying, just pointing it out. There is a reason for the color red. And it is, kind of says danger and excitement all in the same time. It's all kind of wrapped together. So keep the color red in mind if you want a little excitement somewhere. I mean, ergo, the red light district, right? There's a reason why it's called that. With that, I'm going to sign out. So Jody Topitz here, we2me, Divorce Decor, and much more today, way more than normal. See you guys next week. Thank you.